My name is Cassandra. I am the African, Caribbean, and Black Program Coordinator at Moyo Health and Community Services. And Moyo is, it was previously known as the Peel HIV/AIDS Network. So we service those who are at risk of or who are living with HIV in the Peel region, which includes Brampton, Mississauga, and Caledon. And my work specifically is dealing with ACB communities. And that is all encompassing, whether it's ACB men, women, or gender diverse folks, newcomers, the whole community for Peel, just providing support, whether it be through food baskets that we provide or through programs centered around advocacy and education around sexual health. And Moyo, in its broader sense, provides support for HIV, for those who are HIV positive, whether it be like referrals to doctors or other social services. And that also includes gender diverse folks and families. A lot of Black LGBTQ plus folks, they can face a specific type of isolation because a lot of times they're isolated from their families, which a lot of us depend on our families for support. But a lot of times those who are gender diverse or who are LGBTQ plus, they can't rely on their family. So a lot of times they're navigating, whether it be education, the justice system, healthcare, any of those systems on their own. So that can create a real isolation. So a lot of times when we are encountering folks from this community, we are sometimes seen as like their only sense of support because they're not necessarily getting that from their family. So one organization that we partner with is the Black Youth Student Success Initiative. So that is centered mainly around, or specifically around, Black youth receiving supports within the educational system and really advocating for Black students. And we partner with them as well as other organizations within our community. So when Black LGBTQ plus folks come here, they can get support from us, but they'll also receive a lot of information about other services in our community. So we can't necessarily target the student. We can target the parent, which I think also provides more support because, like I said, a lot of times this community is facing isolation within their family. So trying to provide services around like inclusivity, educational sessions to parents can also be like a great support for youth as well. It's called Families in Transition, and it's an annual group for parents of trans and non-binary youth to, learn more about the supports that they can access for their children, as well as like how to create an inclusive environment for their children. So I think this is an awesome program specifically for parents who might have questions around their youth or like how to support their youth who are gender diverse but don't know how to access that information or what language to use, all of that stuff. So this is a great program. It's 10 weeks. So again, it's also building connections within your own community. You get to connect with other parents who might be sharing the same experience as you. If they're experiencing barriers in the educational system, if they're experiencing barriers in the justice system, they feel comfortable enough to like confide in their parents so that they can advocate for themselves, right? So that's one program. And then specifically for Black LGBTQ plus youth who are over 18, we do have a lot of programs centered around LGBTQ plus individuals. We have Gender Journeys, which is for trans and non-binary individuals. And this is really a space for them to learn more about the services available in Peel, as well as to share their experiences and like grow as a community. So again, it's a great opportunity, especially during this COVID, where a lot of people are feeling isolated. It's a great chance to connect with other folks in your community. And we also have Totally Outright, which is a similar program focused around trans, gay, bi, and queer men between 18 to 29. And again, that's like building network, building community, having discussions around maybe like some of the stigmas, barriers to services. So that's just a snippet, but again, provide overall support. So whether it is like as simple as like maybe you need like a family doctor and you don't know where to go, we can provide that service for you. If you are maybe struggling and you might need food, we provide monthly food baskets for our clients. So yeah, that's just a snippet of the specific services for LGBTQ plus individuals, but we do provide like a wide array of services for all folks in general. So you can visit our website. It's Moyo, MOYOHCS.ca. And under the contact us section, you can put in an inquiry where our staff would reach out. And then depending on the need, we would refer you to like the appropriate department. You would be sent to one of our departments. And then if you are looking for services that we can't provide necessarily, then we would refer you to our other agencies. So like, let's say you're looking for housing support, we might refer you to our Place Peel. Again, if you're looking for school support, if you're a parent who has questions around like what options do I have for my Black child in the school system, then we would provide, or we would refer you to BYSSI. If you had like other health needs, we might refer you to Roots Health and Community Services. So we do a lot of referrals that way. But if it's specifically around like sexual health or HIV prevention and care, then you would most likely be taken in as a client, and we would start, figuring out what you would necessarily need, what your history is. But most of our clients are HIV positive, at least in my department. Or if they're requiring harm reduction supplies, then they would be considered a client for the harm reduction department. So it just depends on what the needs are necessarily of the person who's interested in contacting us. Prior to the pandemic, anybody could walk in. If anybody had any needs, we're located also at 7700 Her Ontario Street, which is around Her Ontario and Ray Lawson near the Walk of Fame. But yeah, before the pandemic, folks would be able to come in and speak with us, and depending on the needs, they would be met with one of our staff. Currently, because of the pandemic, we are still virtual, so folks could call our phone number, 905 361-0523, and then they would be directed to one of the departments depending on their needs. A lot of our work is centered around providing support for those who are at risk of HIV, which includes the ACB community. So I know for me specifically, I have a lot of programs centered around specifically Black women. So for example, our Young Black Women's Project, that's like a program centered around educating Black women around sexual health services in their community, the importance of getting tested regularly and having those conversations with your partners. So that's one program that we have. We also have a lot of programming directed towards our Black Muslim community, again, around sexual health and advocacy within our relationships. And then we also try to provide like events centered around like our Black community in general. So for Black History Month, for example, we just had our event that was centered around advocacy, just providing skills for Black folks to use regardless of the situation, whether it's in healthcare, whether it's in the educational system, the justice system, or in your relationships. So we try to provide events such as that, as well as events for Pride Week and all of that stuff. So we do provide like a lot of support for our Black community in terms of healthcare, specifically sexual healthcare. That's a short snippet of what I do. But again, we do really try to reach out to all communities that are marginalized or at risk of HIV transmission. So we do have a lot of programming directed towards women in general, gender diverse individuals, again, those who are using drugs and need harm reduction supplies. Or using substances, they can contact us as well. We have a really, really awesome harm reduction department that can provide a lot of support for those in the Peel region. And then again, like if you are someone who is living with HIV and may have questions, if you're new to the region, you might not know where to go, this is really a great place to start, because we do try to provide all around supportive care. Again, like social supports, as well as legal or referral supports as well.